Welcome to another episode of Med Madness, where we dive deep into the complexities of medical conditions that you need to understand, whether you're a medical student, a healthcare professional, or just someone with a keen interest in health. Today, we'll be discussing a condition that affects millions of people worldwide, Obsessive-Compulsive Disorder, or OCD. OCD is a chronic mental health condition characterized by distressing and intrusive thoughts known as obsessions and repetitive behaviors known as compulsions that individuals feel driven to perform. These behaviors often interfere with daily life, causing significant distress and impairment. Next, let's discuss what obsessive-compulsive disorder really is. It's more than just being overly neat or checking things twice. It's a complex condition where individuals experience persistent unwanted thoughts, urges, or images, referred to as obsessions. These obsessions create a significant amount of anxiety. To alleviate this anxiety, individuals engage in repetitive behaviors or mental acts known as compulsions. For example, someone with a fear of contamination might wash their hands excessively, far beyond what is necessary. Common themes in OCD include fears of contamination, aggressive or sexual impulses, a need for symmetry, and fears of causing harm. The compulsions can vary widely but often include behaviors like checking, cleaning, counting, or repeating actions. These compulsions are usually not logically connected to the obsession but are performed to prevent a feared event or to reduce anxiety. The diagnosis of OCD is based on the presence of these obsessions, compulsions, or both. Importantly, these symptoms must be time-consuming, taking up more than 1 hour per day, or causing significant distress or impairment in social, occupational, or other important areas of functioning. On the pharmacological side, selective serotonin reuptake inhibitors, or SSRIs, are the first-line treatment. SSRIs such as fluoxetine and sertraline help to reduce the symptoms of OCD by increasing the levels of serotonin in the brain, which is thought to play a crucial role in mood regulation. Next, let's discuss how OCD is treated. Treatment typically involves a combination of cognitive behavioral therapy, or CBT, and pharmacotherapy. The most effective form of CBT for OCD is exposure and response prevention, or ERP. ERP involves exposing patients to the thoughts, images, or situations that trigger their obsessions and then preventing the compulsive behaviors that typically follow. Over time, this leads to habituation and a reduction in anxiety. Now let's consider a real-life case study. A 35-year-old woman has been struggling with OCD since her teenage years. Her primary obsession revolves around the safety of her family. She constantly worries that she might unintentionally cause them harm, leading to compulsive behaviors like checking and rechecking the stove, the locks on the doors, and even counting the number of steps she takes to ensure that nothing bad happens. These rituals have become so time-consuming that they interfere with her daily activities, leaving her exhausted and anxious. Despite knowing that these behaviors are irrational, she feels powerless to stop them. After seeking help, she begins cognitive behavioral therapy with a focus on exposure and response prevention. Over several months, she gradually learns to resist the urge to perform these rituals. With the support of her therapist and the use of an SSRI, she sees a significant reduction in her symptoms and regains control over her life. To wrap up, obsessive-compulsive disorder is a serious condition that can significantly impact a person's quality of life. However, with the right treatment approach, including CBT and SSRIs, many individuals can manage their symptoms and lead fulfilling lives. If you or someone you know may be struggling with OCD, it's important to seek professional help. Thank you for listening to this episode of Med Madness. We encourage you to test your knowledge by engaging with our pre- and post-podcast quizzes and to reinforce what you've learned with our Anki flashcards. Stay curious and keep learning. Until next time.